today we'll be talking about bacterial vaginosis that some people call vaginal vaginosis. You see, many people when they hear bacteria, they think they are something bad. No. We have good and the bad bacteria in the body. The good ones are needed for everybody to function optimally in different parts of our body, while the bad ones are very bad that we need to get them off our body. That is why sometimes we use antibacterial herbs or antibiotic herbs to combat them. Now, when you hear about bacterial vaginosis, what comes to mind? This has to do with the female vagina. On the vagina, there's something that is popular that people always say, that you don't need to clean the vagina, you don't need to wash the vagina. Vagina itself finds a way of washing itself. If you now use some product on your vagina excessively or from time to time, it could lead to very harmful health issue called bacterial vaginosis. So let me explain what bacterial vaginosis is. It is a situation where you have the harmful bacteria more than the healthy bacteria. For example, you have about 70% of harmful bacteria and then you have 30% of the good ones. In this case, there is nothing you want to do that will take you away from having bacterial vaginosis. So when you have bacterial vaginosis, there are some things that would happen to you. But before we go there, we should tell you that any woman can have bacterial vaginosis so far you are within the age of 15 to 41. Women of other ages can also have it, whether you are a virgin or not, whether you have had sex before or not, you can have bacterial vaginosis. But there are a lot of things that leads to bacterial vaginosis. One of them is hormonal reaction or changes. When your hormone changes, it is possible for you to have bacterial vaginosis or vaginal vaginosis. Or sometimes when you are using some kind of drugs and the drug interacts with the bacteria in your vagina, it could also give you bacterial vaginosis. Another cause could be that when you have a new sex partner, for example, you are dating Femi before, and after leaving Femi, you went ahead to date Tulog or you went ahead to date Sholanke. One of the three might have what would affect you to have bacterial vaginosis. You know, there's a difference between you changing sexual partner and you having the three of them together at a go could put you at a risk of having bacterial vaginosis. Another thing is pregnancy. About 60 to 70% of pregnant women are prone to having bacterial vaginosis. Why? Because during the stage of pregnancy, there is always hormonal changes. Their hormone will change. That is the period where you start lactating. During the period of lactation, hormones has changed during that time. That is where a lot of changes will happen in your body. So you are prone as a pregnant woman to having vagina or bacterial vaginosis. Another thing is when you are unhygienic, when you don't take care of yourself very well, you could have vaginal vaginosis. And another thing is belching. I said vagina keep watching themselves naturally. So if you are the type that always buy different products, when you just finish having intercourse with your partner, you went into the bathroom or washroom and pick up soap and use it to wash your vagina, see vaginal vaginosis or bacterial vaginosis is not too far from you. What are the symptoms of bacterial vaginosis? Number one of it is unusual vaginal discharges. It could be creamy, milky, foamy, and smells like fish. You know, some people when they sit down beside you, you'll be smelling something like rotten fish, or you might be having intercourse with your woman and you'll be smelling rotten fish. To even have second round will be a problem. Even the first round, you won't finish it in peace. It could be a symptom of vaginal vaginosis. Another thing is burning sensation. In most cases, when you have burning sensation, it could be as a result of urinary tract infection, UTI, or severe gonorrhea. However, you can have burning sensation when you have vaginal vaginosis. Another thing is itching around the wall of the vagina. Some people, they can, just keep itching, scratching from bus stop to bus stop. In Yoruba land, we call it Kobon bus stop or Kuru Kuru. When you keep itching like that, it could be a symptom of vaginal vaginosis. Another thing is vaginal irritation. When you have all these things or some of them and you have been diagnosed of vaginal vaginosis, truly, you can use antibiotic to treat it. But at Asiwaju herbal therapy, we have done our research and we've seen that many people are now building resistance to antibiotics, and this resistance is making people to use antibiotics beyond the normal stipulated time they should use it, which could be harmful to our body system. And at the end of the day, when you use antibiotics to a level, it could even drag down your immune system. So because of that, we have come up with a do-it-yourself herbal solution that you can do at home. Just 4 plants that you need to get. When you get all these things together in moderation, put them together and you soak it. With that, you'll be able to solve your problem of vaginal vaginosis without breaking the bank, even without going to any pharmacy. Just get bara that we call bitter gourd, get ginger, get tagiri, and get ewe okparun. Bamboo is okparun. You get these 4 things, put them together and soak them in original palm wine for 3 days. After soaking it, start taking it. Within 2 to 3 days, the vaginal smell and everything would go and you live a healthy life. And your boyfriend will do 2nd, 3rd, and even 4th round if he has the energy after taking Pelurie and Konramo from Asiwaju Elegbogi. Thank you and God bless you. Have a wonderful day. Kindly follow us on Facebook, TikTok, Instagram, and YouTube at Asiwaju Elegbogi.